Hi, I'm Dr. Angela Lotsikas, and today we're going to talk about Baby Botox and Botox Sprinkles. Recently, a lot of patients have been reading in beauty magazines and asking me a little bit more about Baby Botox and Botox Sprinkles and what does that actually mean. Baby Botox, we see younger patients asking about that because they're really trying to prevent wrinkles, fine lines, the leavens, things that they see maybe in their moms or grandmas, and they don't want to look like that as they're getting older. And then for the sprinkles, it's some of my more mature patients who want to have expressivity, want to look like themselves, want to look freshened, want to look more youthful, want to look more relaxed, but still look like themselves and match themselves. So it's very important when we evaluate, or when I evaluate my patient, is to look at them, do an evaluation, see what their goals are. What are they looking to improve upon? How do they feel about themselves? What bothers them? And we really individualize the treatment to have a very natural, fresh glow, to improve the tone and texture of the skin. And all of this can be done with Botox or Botox equivalents like Dysport or Xeomin. Sometimes people have a certain preference. Otherwise, we use a traditional Botox that everybody knows about. And what we're trying to do is soften the lines of expressivity without a frozen look. So in the past or some years ago, people were looking more for a frozen look, or they don't like the frozen look. It looks like you could like skate off your forehead, that it's just so smooth and you couldn't move your face and you really didn't look like yourself. That's really not my goal and what my patients are looking for. And we're really looking to soften those lines so that you can still move your eyebrows, you can still smile and look like yourself, but without etched in lines. So we can achieve this, and for my mature patients, we call them sprinkles because we don't want to close somebody's eyes. So it's really important that when we're doing Botox in the glabellar area, if we're doing or trying to lift up the brow, we're trying to have more of an open eye. And if you overdo it or put too much Botox in, you can get a very flat brow, a flat eyebrow. Maybe you don't have wrinkles, but you don't have the expressivity and the eyes look really tiny. And that's not something that we want. We want our eyes to look open, bright, and fresh. So we sprinkle the Botox and we look at their movement, and we maybe do it even 2 stages where we do an eyebrow lift first and then they come back, and then we can address more of the lines on the forehead if we need to. Versus for our younger patients, the idea of Baby Botox is I don't want those lines to come up. I'm starting to get them. I don't want that much. I only need a little bit. And then we target those tiny little lines to soften them and to give them a relaxed, fresh look. Botox lasts about 3 to 4 months. It's pretty quick and easy. It's relatively painless. The results come to play, for depending on which product you're using, between 5 to 10 days after the procedure. And if you don't like it, it wears off, which is great. I always tell my patients that a little goes a long way. I much rather do a little bit, soften the lines, and if we think that we need a little bit more for them to come back, and I can always add more rather than putting in too much or having a brow, a flat brow or a brow ptosis, which really doesn't look good. We really want things to be open and fresh and smooth. So if you have any questions or you want to talk to us more, please make an appointment and come in and see us, and be happy to answer more questions for you.